I'm the Executive Director of the Association of Ontario Health Centres, and I'm here today to support the Social Services Network in their request for a community health centre for Markham Richmond Hill. Richmond Hill doesn't have a community health centre at this point, and community health centres are important places for people to get primary health care for the community, the individual, the family. In Markham Richmond Hill, there's a high percentage of new immigrants into the community, for racialized communities, for seniors who need a lot of health care, and so this is a prime location for a community health centre for this community. It's where you come to get primary health care. It's where you can see your doctor, your chiropodist, your social worker, a physiotherapist. If you have diabetes, you can get diabetes education, all under one roof. It's about treating you when you're sick, but also trying to keep you healthy for the long term. Community health centres are funded by the Government of Ontario through the local health integrated networks. So it's your taxpayers' dollars at work that try and bring a community health centre to this community. In 405, Ontario government announced the largest expansion of community health centres in the province of Ontario. So we now have 73 community health centres, but it only serves about 4% of the population, and we believe that the kind of need that a community health centre can meet should meet about 15% of the population. And so up in Markham area and in the Richmond Hill, there are no community health centres, and so we figure it's time for this region to get one as well.
So what kind of funding, how much like budget to set up the 60 in Markham and Richmond Hill?
So a community health centre in Markham Richmond Hill would see about 4,000 to 5,000 clients, and a budget would be in the range of a couple $1 million to provide the services. But all of our physicians, everybody is on salary, including physicians. So that covers all of the salary and the operating costs for a community health centre.
So today event is telling the government of Ontario we have the needs, and then you're doing it right now, is that right?
Well, right now the government hasn't made an announcement about when they're going to expand the next round of community health centres. So we figure that part of the election coming up, we're actually all three political parties to support the expansion of 250,000 more people to have access to community health centres across the whole province. However, one of our urgent needs is in Markham Richmond Hill, and we have the Social Services Network as a lead organization to make it happen.
So how many CHGs needed in Markham and Richmond Hill?
We're going to start with one, but it's a community that could use 2, 3, or even 4.
I think today's event is like trying to get up the public support to get this done.
It's the public support as well as to get the leaders' support of all three political parties. So you'll see a little bit later tonight where all three candidates for the upcoming election will be asked to support a call for a community health centre for this riding. So it's about the public support and as well as the hospitals, the mayors, the social service agencies in this community, all to support the community health centre for this community.
So what's the chance getting it?
This community is extremely well organized, and I think they've made a very strong case for a community health centre. We just now have to convince the government that this is the time to announce a community health centre for Markham Richmond Hill.